Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Welcome back, everyone. I want to call her a trailblazer when it comes to rehab of canines and animals in general in New Mexico. She has a wonderful, wonderful facility, Canine Physical Rehabilitation of New Mexico. Kind of started the trend there of bringing our animals back to health, and it's great to have her back with us. Dr. Laura Hady joins us on the program. How are you doing today?
I'm doing fantastic. I'm ready to tackle a new topic.
Yeah, this is one that when it comes to dogs, we take it for granted. They're always moving around, but knees, I don't even know if we'd even say they have a knee. Tell us more.
Yeah, so a dog's knee is going to be in a similar location to ours. The big difference between a dog knee and a human knee is that we're built straight up and down. And so a dog's knee is more at an angle. So between the femur, which is the long bone of the leg, and the tibia, which is the shin bone, basically there's about a 90-degree angle. And it makes them have more shear force through that knee. And it can be easier in some breeds for it to tear than other breeds. The thing that we need to think about in relation is, again, we walk on two legs, so we have to shift the other bit of our weight 50-50 to our other leg. Whereas a dog, they have four legs, and 60% of the weight bearing is on the front two legs, with 40% being on the back leg. So that's only 20% of their weight bearing on each hind leg. However, where there's one, there may be two. So we're not just one and done when we look at the knee. Typically what we're finding in these dogs, if they should happen to tear that cruciate ligament, or ACL would be the equivalent in a humans, they have a 50% chance of also tearing the other knee, the cruciate ligament, and that can really create some instability in the back end and take the brunt of the mechanism on the leg up into that hip and lower back.
Oof. We just see them running and not having any issues. Is it very possible that a dog could be experiencing some pain and having some trouble, but we wouldn't even detect it until later when it's maybe too late and now you have, some
Right.
surgery?
So what they're finding is that we tend to think when we're watching football on TV and they say that the running back blows a knee, we think it's basically an acute type of injury. But in reality, it's an acute on chronic type of injury. If you think of that cruciate ligament, and that's that ligament going from the femur down to the tibia, and it's the one in the front of the knee, it's like a rope that untwines.
Hmm.
And so with time, it can untwine, untwine, untwine until it completely tears. And even if we say, well, we feel a partial tear in that cruciate ligament, or I suspect that based on how your dog is walking or sitting, what can happen is that there is no good blood supply to that ligament per se as there is in a muscle. And so it's not just going to heal or reattach on its own. So what I tell people is that, yeah, maybe you saw your dog jump down off the couch and it was lame and it got better within 2 weeks, whether you gave it rest or you gave it an anti-inflammatory, and then you just didn't notice that the dog was having a problem, because that knee's not going to swell like it does in our knee.
Has things changed over the decades with our dogs? I'm wondering, even back in the day, did they have the same type of problems? Lifestyle changes, anything? Is there something different now?
So there's about, I would say, three things that we can talk about today in that. One is our dogs used to get more exercise. They used to roam in the neighborhood. I grew up in a rural area. They were out and about. Now we have, owners that walk their dogs every day or do things with them. But as we are entering in a more sedentary lifestyle, the same is happening with our dogs.
Mm.
So the conditions of our muscles that surround joints aren't as good. The second thing I think that we have to look at is when we breed for, we're looking at a taller dog, say we want a taller dog, and we like breeds that maybe have straighter legs because they're getting taller. Think of the Labrador Retriever, it's not how it used to look, or the Heeler, or an Australian Shepherd, or a German Shepherd in per se. They're not all going to be those lovely racing greyhounds on one end, or the border collies that have a lot of angulation in their lower joints, because we all think of a border collie crouching as it goes to herd sheep, or when it works. And so when you decrease the angulation between the joints of the back limbs and the front limbs, you decrease the ability to move in explosive manners as well, and to make sharp turns, which is what a working dog or a dog in the wild is going to have to do. The third thing that some people have looked at is that because we're doing super early spay and neuters, say in shelters, say as early as 8 weeks, if the animal makes the weight cut, is that are we changing the hormones of the animal? And they have shown that there is a delay in the last growth plate to close, and that's actually at the tibia or the shin bone. It's at that tibial crest. And so some owners now, particularly if they have sporting breeds, they're waiting a little bit longer to spay and neuter those dogs until that growth plate has closed, due to a potential increase in the amount of ruptured or torn cruciate ligaments in dogs.
Are there breeds that are more susceptible to these knee issues?
Certainly. So I would probably say the number one breed that I would see for this would be the lovely Labrador Retriever. So he was out chasing the ball, came up lame, and again, that's what I would think of. Our labs are big eaters, and so a lot of our labs in the United States tend to be a little bit more overweight. The second breed I would probably say would be that I would see would probably be the German Shepherd. German Shepherds are very popular breeds. Another one that would be in there that used to be a very popular breed would be, say, a Cocker Spaniel.
Mhm.
And theirs has a lot to do with how their collagen or the elastic tissues in their body, the connective tissues, are put together. So those would probably be my top three, although we could see it in something as simple as an Akita, a bigger dog that's having issues, or a lot of people like Huskies, particularly in the northern areas of the country. So the sky's the limit. The main time I would see it in a smaller breed, such as a Chihuahua or a poodle, would be because they have a condition called medial patellar luxation. So their kneecap pops in and out of place because the groove's not deep enough. And if that's not addressed over time, to provide that kneecap to stay within the groove that it's in, those animals can end up with a ruptured cruciate later in life, like my Chiweenie did when she was about 15 years old.
Wow. Uh, I believe you nailed it with the sedentary lifestyle. That's us compared to 50 plus years ago,
Mhm.
where we were moving around more. And so we're our animals. So we're on the couch watching TV. Guess who's next to us? So they're not getting that
Exactly. And
exercise.
guess who's next to have some of that delicious potato chips that we're eating while we watch the game. So we talked about previously that some of these dogs come to see me prior to the appointment with the surgeon. So it may have been diagnosed by their family veterinarian. And what I basically look at are what we just talked about, the risk factor in those dogs. We talk about basically the biomechanics of the knee, just as we just did. We talk about what are some exercises you can do before or after. So if the dog needs to lose weight, I'll often say, hey, let's get some weight off of this dog, as much as 10 pounds before we do the surgery to
Wow.
make it easier for recovery. If a dog comes to me and we diagnose that torn cruciate in both knees, we will often recommend, sometimes depending on the dog, the age of the dog, the younger the dog, the better that it'll recover from both knees being cut at the same time. Or if we're going to have to wait on a dog, we're going to give maybe 8 to 12 weeks between each knee having surgery. And then what are we going to look at immediately post surgery in those weeks that follow, that may follow a healing process, and then the long term for that dog.
Wow. Um, Lots to consider here. How would you know if you need to visit your vet or somebody like yourself? How would you really know that your dog is having some trouble? Are they just slower? They're not jumping up like they used to on the couch, things like that?
Definitely. And those may be more if it's been more of a chronic problem, say over a 6 month time frame. So basically, what we're looking at is when they come to see me, I'll ask the dog to sit. And if the dog doesn't have a nice square sit with both its feet touching the ground and its knees bent in flexion, you know, and if one leg is kind of out to the side, and we call it cattywanka, is the only term I know how to say
Hmm.
it, where the knee's still bent, but the dog's trying to take the stress or the pressure off because they can feel the cruciate and the pain receptors within that joint. We also have to remember that the meniscus, which are the two shock absorber, the menisci on either side, on both the outside of the knee and the inside of the knee, basically they're the shock absorbers between that big femur bone and that tibia. And if there's a tear in one of those, that can certainly make the dog lamer, more painful. And so what it goes down to is if you see kind of, even if the dog's still bearing weight on the limb, but you notice that I always say it's a stilted gait. So they're toe touching maybe, their knee is the cruciates are very important in preventing outward rotation if they're toeing in. If your dog is toeing in on one of the back legs, that's another way to look at it. I also will feel them when they come to see me. I'll feel them for any muscle tension up in the groin muscle, which is called the iliopsoas muscle. And then we get down to the dynamics of the knee. We look for instability within that knee or what's called drawer motion as the femur and the tibia coming off the front of the femur. And if it's more than about 3 millimeters of motion, that gives us an idea. You can also feel in a more chronic dog that, hey, the capsule or the other ligaments on the outside of the knee or the knee itself feels thicker and bigger, and I can't flex or bend the knee or extend the knee as much as we used to.
Wow. You mentioned meniscus.
Mhm.
So that exists in a dog as well?
Yes, so they have two menisci very similar to what we have in people. Previously in people, what the thought was is, okay, we don't really need that menisci. It's torn. I'm just going to take that shock absorber out. And what they happened is now you're bone on bone, and the animals are getting
Oh,
more arthritis than even before. So now what they'll do is if there's a tear, and again, it's always in a bad location, it's in the back third, and there's not a good blood supply back there. Now they're just going in and just cleaning up the area that is torn in the meniscus and not going ahead and trying to take out the whole thing like they did previously.
I never knew what a meniscus was until, and I've shared this story before, but you say the word, it's a funny word to start out with. I was interviewing Lionel Richie and
Mhm.
he tore his meniscus and he was recovering from that. And I'm like, menisc what? And come to learn, it's near the knee. Um, and here's a man that's always moving around and dancing like a dog. Dogs are always moving
Yeah,
around.
exactly.
So I guess it's that continuous motion that you can tear a meniscus. Wow. Um, so interesting. Like the connection between our pets and us. Um,
Exactly.
right?
Hmm. For sure. I think what we need to think about too is when we're looking at these dogs, I'll go up and I always check the range of motion up in the hip. Because if we also have abnormal hips that aren't put together right, or if we have that tight iliopsoas muscle that I was talking about, that groin muscle, that's going to affect how our hip moves. Then I go right on top of the dog's back and I press in, there's a divot between that last lumbar vertebrae and that sacral vertebrae. And in some of my older patients, I go to press on top of that and the dog just sinks into the floor and cries out. That's going to indicate that the dog has some sciatica pain. And maybe we
Wow.
need to evaluate or warn the owner before the dog would have surgery for this, for the torn cruciate, how are we going to address that lower back issue in the long term?
Sciatica in a dog, didn't even know that existed.
It sure does. It sure does. And it can fool you in the older dogs. So in the younger dogs, and I'll typically say if your dog's going to be active, I think you really should consider surgery, particularly if it's over 25 pounds. In the older dogs, where we may have other things going on, say we might have diabetes, the dog may be overweight, the dog's having back pain, that dog may, and the dog has decreased muscle mass because we lose muscle mass as we age. Are we going to approach that in the same way? We have to figure too, with the price of surgery, is that dog, are you going to do the older techniques or the newer techniques where they cut bone for less arthritis? And so with the older dogs, we have to really think about what we're going to do and how we're going to approach the recovery, the pre-op and the post-op for these patients, if that's exactly what's needed.
What can we do? Massage. You're hanging out on the couch again with your dog. Can it be helpful or impactful to, just massage their legs and their back, area and all of that? Would that even make a difference?
Yes, it'll make a difference because we have to think about those muscles are going to take up the brunt of the work if the joint is unstable. So if we can keep those muscles strong yet relaxed, that's going to be very important. So we may do small circles along the back muscles of the dog. We may have the owner kind of massage delicately within the groin region. We may have the animal uh, resting while the owner's just nicely massaging down the legs and back up the legs to follow lymph flow. That's all very important to warm up the muscles when, in fact, the dog isn't going to be out going for a 5-minute walk prior to other exercises. So that's a good way to warm up the muscles. It's also a good way to relax the tight muscles in the area that are compensating for this knee injury.
What's your first step? Is it going to your vet if you suspect something may be up, or should you just pass go and look for somebody that can do physical rehab or massage therapy maybe?
You can. What you really need is a veterinarian to make that diagnosis of a ruptured cruciate. And that's going to tell you, again, our therapy, our surgeries, our medications are only going to help if we have a proper diagnosis. And so I think that's most important is to get into your family veterinarian. Again, the same thing I realize in this day and age with the shortage of veterinarians, if an owner can't get in with their family veterinarian and they have a valid relationship with them, and I've worked with that veterinarian, or maybe it's the second or third dog I've worked with for that client, I'll go ahead and examine the animal, report back to the family veterinarian, and then we talk about how would you like to approach it? Would you like conservative management, or can I give you a list of potential surgeons and you can talk it over with your family vet as to who they would recommend for, say, your location in town, or say the type of fixation that you would fit that particular animal in that case.
Back to the breeds for just a moment. If you have a breed that is more prone, is it a situation where regular checkups, maybe something's going on with their knees and or legs, you might not even know it. Should you have that on your radar?
Yes, you should. And the nice thing about having that annual exam with or without vaccines is that just yesterday I was doing an annual visit, and the owner had mentioned, well, my dog's about a year ago, and this is maybe like a healer cross. It's a young, fairly active dog. Oh yeah, he had a partial tear about a year ago. We got a brace for it. We decided not to do surgery at the time. Yet when I go to palpate that knee, it's already set up arthritis as if the dog's already 5, 6, 7 years of age. And so I mentioned to him at this point, I don't know about doing surgery at this point. It's just a very young dog. And if you can't afford it at this point, maybe that segue would be physical rehabilitation to make that dog more comfortable.
Hmm. So how do you make the surgery determination? Rehab versus surgery?
If your dog, first of all, sometimes, and unfortunately in veterinary medicine, it comes down to economics. So we'll give them an estimate of, say, for the older extracapsular technique, which was popular when I was in veterinary school and soon thereafter, where they drill a hole into basically the crest of the shin bone, the tibia, and they do a very strong fishing line that's been sterilized, and they make a figure eight behind the knee. That surgery and tie it like a lock and loop to provide some stability. It's called an extracapsular technique. That technique may run in New Mexico $2,000. When we're talking about to have less arthritis over time, it's a police dog, it's a hunting dog, it's an agility dog, it's a dog that goes running with you. Typically, we may recommend the newer surgery, which is called the tibial plateau leveling osteotomy, which is basically big words to say we're going to change that angle of how that knee sits, and we're going to make the forces go back to that caudal cruciate or that posterior cruciate, the one that's still intact, so that the dog will potentially have less arthritis over time. That in New Mexico on a bigger dog may run up to $4,000.
Wow.
The pain management's going to be higher because you are cutting bone in a sense, and you're going to have to follow up. The dog's going to have surgical plates, screws, and whatnot. So and the other thing we have to factor in is, can you recover this dog? Are you going to be able to keep that dog quiet for the 8 to 12 weeks in that recovery period while still doing very minor, maybe physical therapy exercises and whatnot? Because if we send a dog home and it goes and runs out the same day, it can break the bone, the screws can back out, the fishing line can snap, so it has to be a situation in the home where the owners can keep the dog quiet, not necessarily in a crate, but in a confined area. If you've never kept your dog in a confined area before of some type for the recovery, because the UPS man comes and it runs,
Yeah.
you're out of luck there, right? So I always
Wow.
say that's a big determination, is it's a case by case in what I think the owner can do, and what the owner ends up telling me is actually what's going to happen in that home environment.
I mean, I think it's challenging enough if you have an older relative, mom or dad gets, knee replacement, and the rehab involved there to support them. This is double that, I believe. You got an animal that just even wants to have fun and doesn't realize you can't communicate so much. So interesting, Laura, what we've learned today. How do we find out more? Somebody wants to learn more about your rehab center in New Mexico, or even ask you questions. How do they do that?
The best way is probably email. So my email address is KPROFNM@gmail.com, or my phone number that you can text me is 505-280-5962.
Thank you so much for being here today. An important topic that many of us, we don't even realize what could be going on with our animals. So I appreciate that.
Thank you, and thank you for having me. And I can't wait to do another podcast.
Same here. Learned so much. We love our animals. We'll talk soon. We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.